Finally, Roger Frugard's book also shows efforts to cure leprosy. And it said that there were two types of leprosy: Morphia alba, which was curable, and Morphia niger, which was not. And they would puncture the skin with a needle. Now, if it bled, then they could cure the patient. If white liquid oozed out, however, then it wasn't curable. Leprosy would actually decline in England from the 1300s as quarantine and isolation practices took effect. But more about the campaign, the crusade against leprosy, later. Now, our next famous doctor is the great Gilbertus Anglicus in the 1200s, known as the famous English doctor. So famous that he was paid, and some of his colleagues complained at the time, that he was paid the ridiculous amount of £5 a year. Now, in 1205, he was doctor to the Archbishop of Canterbury, Hubert. In 1207, he served the king, and he published his medical book, Compendium Medicine, in 1240. He may have been on crusade with King Richard I on his Third Crusade, 1189 to 92. He claimed that he was. There's no particular evidence that he was, but who knows? He's said to have cured the Crusader Duke Bertram after the failure of the Arabic doctors. Now, it's said in these school textbooks that the Arab doctors knew a lot that the Western doctors did not, and that is true, that the Arabic doctors had preserved the knowledge of the classical world that the West had lost. But actually the exchange of knowledge is actually two-way. It's not all just knowledge coming from the Arab world to the Christian world, as although the Arabic world had preserved the knowledge of classical medicine, the Western doctors were, if anything, slightly more skilled on surgery, and both cultures gained a lot from each other. Now, Gilbertus Anglicus brought the best of Arabic medicine back with him to England, but it's clear that he was able to pass a lot of knowledge back the other way. Now, by this stage, most physicians were university trained in England, although there were only around 100 in England with a medical degree. Now, dissection of people had been banned, but despite this, their knowledge of anatomy was far better than we commonly suppose. The Crusaders dissected the dead and packed them with salt to be sent back home, like the Earl of Arundel in 1221. And this is carried out by doctors and surgeons. And so, although they're not allowed to dissect bodies for medical learning or knowledge, because there was the idea that the dead need to be kept whole to resurrect bodily, they were taking people apart for other purposes. And if you're trying to tell me that a doctor is going to conduct a dissection but not look at the body and go, no, I'm not allowed to learn while doing this, then I'm going to tell you that you're insane. And so their knowledge of anatomy is far better than we supposed, especially as autopsies on suspicious deaths were carried out in this country from 1250 onwards. They also taught surgery with the dissection of animals from 1280 onwards, and Crusader battlefield surgery was actually pretty good. Now, in the 1180s, the Crusaders had battlefield ambulances and field hospitals run by the Order of St. John, known as the Knights Hospitaller. And if any of you work for the St. John's Ambulance, thank you very much for all that you do. And of course, you are the heirs to the St. John's Knights Hospitaller, which is why you've got that lovely black crest with a white cross. It's the badge of the Knights Hospitaller, and you are the last of the great Crusader orders in the St. John's Ambulance. But these Knights Hospitaller would set up mobile hospitals on Crusader battlefields with little tents so that the wounded could come to them. Now, in the 1190s, English troops on crusade at Acre converted a ship into a mobile ambulance and field hospital unit. And so if they arrived in the Holy Land, they were a medical order. They wanted to have a safe ambulance, so they dragged their wooden ship out onto land, put wheels on it, and turned it into an ambulance led by a man called William of the Order of St. Thomas of Canterbury. Again, a Crusader medical order that wore a half-red and half-white cross. They could certainly cure osteomyelitis, which is an infection in the bone marrow. Now, a knight called Bernard got kicked by a horse in the shin, and they treated him with vinegar, which has a range of counterseptic properties. They drilled a hole into the top of the bone and into the bottom of the bone, and then ran vinegar through the bone marrow, which undoubtedly painful, but undoubtedly saved the leg and saved the life. And they could also cure hemorrhoids by cutting away at the anus and then cauterizing the base with a hot iron. And if nothing else, you certainly wouldn't complain of hemorrhoids twice. Now, our next famous medieval doctor is someone called Husende in the 1250s, and she is the first female doctor. And again, this might cause confusion, but in medieval Europe, there were some famous female doctors with formal medical training. Now, she was personal physician to King Louis IX while he was on crusade. She was university educated and highly respected. She had to be. She was personal doctor to one of the richest, most powerful monarchs in Europe. She married an apothecary called Jacques, and they bought a house in Paris after the Crusades. On the Crusades, she went on crusade, and he had to stay at home to look after the family because she earned a lot more than he did. And again, not often included in school textbooks because it challenges the idea that things were bad and that things have then improved. But there were times when women could get medical degrees in Europe, and then that right was taken away later. But in the 1250s, you have Husende working. Now, it's around this time that Oxford and Cambridge start to issue medical degrees as well. Now, our next famous doctor is one who's local to me, John of Arderne, working in the 1300s. Undoubtedly the best surgeon in the UK, and he lives and works in Newark. Now, his work shows how far the medieval doctors have come. He used a lot of anaesthetics and concentrated on cleanliness. His books were sold around the country. He used clean sponges to stem hemorrhages. His advice is still good today. A surgeon must have clean hands, be skillful, and be able to make a patient laugh. He said that firstly it was vital to be clean, but secondly that a patient had to want to get better. He said that if you didn't have an excellent bedside manner, if you couldn't make your patients want to get well, then they wouldn't do. He said that they had to want to live. He discovered how to cure anal fistulas, which he believed was caused by riding all day on wet saddles. He wrote in the most scathing of terms about the knights, which he said were boys who had failed to grow up riding around on their wet saddles, getting ill, waving around their sticks at each other. He said that's what caused the anal fistulas. Now, the sign when he started working of a doctor was a bowl of blood placed in the window. But he was unhappy about this, and he said that this was unclean, and this was making his patients sick. So he changed that sign to be a wooden red arm wrapped in white bandages, which then later got simplified to the red and white stripy pole of the barber surgeons. The idea comes from John of Arderne, working in the 1300s. Now, to dull pain, his anaesthetics were henbane in alcohol. He used black and white poppies, mandroga or hemlock. He recommended chamomile oil for earache, pomegranates for digestive ailments. He experimented with giving patients enemas by squirting liquid up them by using pig's bladders. Some of his ideas were less effective. He tried to cure smallpox by the use of scarlet cloth. It has to be said that infrared light can prevent smallpox scars, but I don't think you can achieve that by just draping scarlet cloth over them. But this period also saw the first public health information campaign. He said that foul-smelling homes were to be a sign of sickness, corruption and decay. So the first job of every person was to wash themselves and clean their houses. Hands were to be washed before every meal. If only we did. I mean, we've all seen the queues of people buying soap and hand wash. Were they not washing their hands beforehand? People have forgotten the advice of John of Arderne in the 1300s to wash your hands before every meal. And he also launched the first national first aid campaign, launched in churches. He said that if you find someone comatose on the ground, place a bowl of water on their chest to check if they're breathing. Now, is that the best piece of... If you're only going to give people one piece of first aid advice, is that the piece of advice you should give them? Probably not. But the attitude that it's their job to give people first aid advice shows that they're not the quacks that we have taken them for.